Hey everyone! I am being joined by Steph Keller today from Legacy, who is a very experienced fertility nurse, and she also has been working in the field of fertility and andrology for over a decade. And at Legacy, she delivers one-to-one results, semen analysis results. So she is used to telling people what tests mean, what they can do, all sorts of advice. As many of you may know, I have a husband who has azoospermia, so zero sperm, and so I know firsthand what it can feel like on the receiving end to be given difficult news. So we're going to be talking all about that, and if you've got any questions for Steph around getting sperm checked, male health, please do ask them, and what to do if perhaps your partner or your results aren't what you wanted them to be. What happens next? So she should be joining any second. Here we go, and we will go live. So have your questions ready. Hi to those who are joining. Nice to see you today. Hello, Steph. Welcome.
Hi, how are you today? Sorry about the technical troubles getting in.
No worries, no worries. I've given everyone a brief background and summary about you and your expertise, but please introduce yourself and Legacy and your role there. And I'd love to ask you some questions around sperm analysis results and what to do next.
Sure, absolutely. So my name is Stephanie Keller. I am the Senior Manager of Clinical Services with Give Legacy. I have been with this company for the last year, but have spent the last 10 years working in men's health and infertility. So I've been around the block a few times in this field, and would love to share any bits of information I can to help you and your viewers out.
Thank you so much. And anyone who's watching or listening, if you have any questions for Steph, want to get sperm checked, have got results that you may want to question, then please feel free to ask as we go along. I don't know if you know about me, but my husband has azoospermia. And so when we found that out, it's due to Klinefelter syndrome. When we found that out in the UK at a clinic, we had a less than desirable experience in the way that he was told that result, and we were literally left hanging, not knowing what to do next, what it meant. And so I think it's fantastic that, you know, Give Legacy is out there supporting people with all of those steps, not just giving people a result, but holding their hand to talk about next steps and what might happen with a urologist, and what might be the next, you know, process to obviously getting to where they want to be. So love to hear more about that. The first question I have is, does an abnormal semen analysis mean that you are infertile?
Absolutely not. In some cases, that could be the end result, that people, determine that there is infertility, but abnormal results do not equate infertility. There's, many different things that could be going on. It's important to really understand your parameters, what they mean for you, and then knowing the next steps to take.
Mm-hmm. Mm-hmm. Do you think that there's misinformation out there and miseducation in terms of like what is a normal analysis, and whether do you think people jump to conclusions that that means I'm not going to be able to have a baby?
I hear it, unfortunately, every day. And I'm constantly explaining to people, just because you're outside of the normal reference ranges does not necessarily indicate you have a problem at all, even. So it's important to be careful, look where you're looking on the internet. There's so much misinformation out there. Know your sources, make sure you're getting good, validated, scientific information.
Well, that's why having conversations with Legacy, yourself today, is just brilliant. So thank you so much for your time. Do people jump ahead and think, if they're trying for a child and that's why they're testing their semen, do they think, oh, this means I'll never be able to have a child naturally, or we're going to go into IVF, we're going to need IVF, what if IVF doesn't work? How do people know what to do next? Because I know you deliver the results to people.
Yeah, so a lot of times people come to us, we're ready to have a results call, and they say, okay, so where do I have to go for IVF? And sometimes it's explaining, you may not necessarily need to do that. Not everybody who has abnormal results, like I said, has a problem. So next steps typically are going to be, understanding the parameters better, knowing when it's time to either retest or make some adjustments in your life. There's many things that can be done to help improve sperm parameters that people are not even aware of.
Mm-hmm. So how does Legacy work in terms of testing at home?
So the way that Legacy works is clients are able to go online and purchase a test kit. It is sent to them in discrete packaging, so no one knows what you're getting or sending. They're able to produce their sample at home, which eliminates that very uncomfortable and awkward clinical experience. It sounds like your husband may have had that as well. Unfortunately, people can do this in the privacy of their own home, ship their sample back to us, and our labs are going to analyze that sample, and then people can have a free results consultation with either myself or another one of our healthcare providers to better understand their parameters and what their next steps should be.
Mm-hmm. Do you find that people have sort of Googled what results might mean before they speak to you?
Yes, I would say almost in every case, people have been on the internet, and I don't think there's anything I haven't heard as of yet. And I hear all sorts of crazy things about, well, okay, I read that if I eat this specific seed, it'll fix everything, or, understanding that it's not quite that simple. But yeah, people definitely spend a lot of time on the internet and getting a lot of misinformation.
If Legacy have written some absolutely fantastic articles for us on our website, fertilityhelphub.com. If you head to our link in our bio, I'm going to link up their website so you can read more about all of this. And also they offer very kindly our readers a 20% discount with code FHH20. So feel free to use that at checkout. I obviously just previously touched on the fact that we had a bit of a negative experience with the way that my husband's results were delivered to him. When you have to make those calls, what emotional support is available? What's the emotional help there?
So there's lots of emotional help available out there, either through, if you're speaking with one of our providers, during a results call, certainly messages are delivered lightly, as well as understanding that you can't give someone a definitive diagnosis after just one single semen analysis. That's important to understand. There always needs to be repeat testing in those cases, especially when there's something that is, quite abnormal, like azoospermia, for example. You would always want to repeat. Then there's follow-ups that are needed. So just because someone's azoospermic doesn't necessarily mean, again, that they wouldn't be able to have a child of their own. It just means they need to take some more steps to determine what type of azoospermia they have. Is this obstructive or non-obstructive? And then what their next steps will be. So it isn't always, panic time when you first get those results. And I know that's the hardest part, I think, for most people. They're delivered a message quickly. A doctor either makes a phone call or comes in and out of a room and says, here you go, and bye, and they're right out the door. So I think that's somewhere that Legacy can provide such a great service. You've got 30 minutes with a professional in the field that's going to sit and chat with you about whatever you want to talk about, better understanding your parameters. How do I navigate what to do next? What are my options? Having somebody that can sort of guide you through this process is enormously helpful for those, because it can be quite shocking when you get an abnormal result. No one's expecting to get a result that says azoospermic, or even just anything that says there's anything wrong at all. Most people, I find, are generally surprised.
When my husband got it, he was in the clinic and I was at work, and my results had been okay in the morning, and he called me and he just said, I have no sperm. And I was just in shock, and he was in shock, and I was like, well, what does that mean? What can we do? And he was like, honestly, please don't ask me, because I don't have any answers. I don't know who to speak to next. I don't know what to do. I don't know what this means. And it was just a horrible couple of weeks waiting to find out what to do and what that meant. Whereas obviously that kind of support, where you straight away can speak to, a professional in that field, can give you a bit more clarity and some answers on why it might be the case, what you can do next, retesting, etc. Just such a better experience if you can have one when having bad news.
Absolutely, I agree.
And you mentioned retesting. How frequently do people retest?
Depends on the situation. People are coming to us at all different points in their fertility journey. Some people are pre-planning. Some people are just, I've been trying for a month. Other people, it's been 6 months, a year, even longer. So that would sort of determine, where you would go next for retesting. So having a conversation with a professional about, here's where I stand now. This is what my situation is and what's going on. What do I do? What's best for me? It's greatly varied.
Yeah. Are there certain parameters that are more kind of important than others when it comes to assessing fertility or male fertility?
Yeah, I would say probably, when talking about natural conception being the plan, typically the most key indicative factor on someone's semen analysis as far as their likelihood or probability of conceiving traditionally is going to come down to that total modal count.
Yeah.
What the total modal count is for anyone who isn't aware, it's really just math of averages, factoring in the three most important pieces that are on the report. So that's going to be their concentration or count of how many sperm are in the sample,
Yep.
the volume of ejaculate that the sperm are contained in, and the motility, which tells us how the sperm themselves are swimming and moving.
Okay, we've had a couple of questions come in. Would you mind if I ask them?
Absolutely, go ahead.
Obviously, these are, this is personalized questions that people are asking. So please do get in touch with Legacy if you want to test through them or have further analysis done. But if someone were to get fragmentation analysis, what would that sometimes mean and what would happen next?
So DNA fragmentation is analyzing the DNA in the sperm. Everyone has some level of fragmentation to their DNA. This is just going to help to better assess, whether or not they would be someone that would be more prone to having pregnancy loss or difficulties conceiving. It's the integrity of the internal sperm's DNA.
Okay. This is a really good question. And I remember thinking this myself. How long before giving a sample should a man refrain from having sex?
Good question. So oftentimes people think the longer you wait, the better. It's going to be, a much better sample if I just wait weeks. In fact, that is not true. Usually the guidelines would be anywhere between 2 and 5 days of abstinence prior to producing a sample. I think the golden number is about 3 days. That's typically what I would recommend.
Okay. And how long does it take to get test results back when you send them off?
Usually within 24 hours.
Oh, wow. Okay.
With Legacy, obviously with different labs, I can't guarantee what another lab or hospital would do, but with Legacy, typically results are within 24 hours, 24 to 48.
And we've got an array of readers who are, interested in obviously fertility, but also might be family planning, like you mentioned, and just curious about fertile health, might be looking to freeze. Do you see people testing for all sorts of reasons? Testing sperm?
We do. Oh, absolutely. Yeah, I think a lot of pre-planning is going on. People are just curious. Can I have a child? Am I able to? Am I fertile? I think it's a great idea to test in advance, especially people who are waiting to conceive until later in life. It's good to know where you stand, where your baseline is, because like I had said previously, there are many things you can do, things that are, lifestyle related, changes you can make to help improve sperm parameters, supplements you can take, things you can do to better set yourself up for success in many cases.
Absolutely. Great advice. And next steps, I know we've covered that loosely, but say for example today you were giving my husband a result that was less than favorable, whether that's azoospermia or something that outside of the parameters, what would happen next?
So next steps would be repeat the test. Also, just to be sure there were no anomalies in the testing, let's make sure that we're confirming that we're getting that result or similar result twice. Then seeing a urologist is really important because there is only so much you can do over a results call on a Zoom or on a phone call. There needs to be physical exams, sometimes lab work or imaging studies that need to be done. You need a little bit deeper of a dive into the underlying cause. So next steps, I would say, is with a fertility urologist.
Okay. And people have access to that through Legacy?
So Legacy does provide a service where for our clients, we would refer them to a urologist in their area. That isn't something that's on their public website, but they do have a Find a Urologist tool where you can plug in your zip code and find somebody near to you, and get some suggestions as to where to start. If you're not a Legacy client, you can always reach out to your primary care doctor and they could refer you as well.
It's always nice to know where to go, because when you're in that sort of state of panic or just uncertainty, it's just like, where do I begin? So to go to a trusted source like Legacy and find someone that that you've had recommended to you is a really good thing. Couple more questions if you have time.
Sure,
please.
Absolutely.
We've talked a little bit about azoospermia, and you mentioned non-obstructive versus obstructive. Please, could you just explain that to people who might not understand the difference or might not know the difference?
Sure. So there are conditions. I mean, there's so many things that, that could indicate either obstructive or non-obstructive. There are conditions that people can have, things that are genetic conditions that would prevent them from having vas deferens or producing sperm at all. And then also there are obstructive things where there could be a blockage or something else going on that could mean that they still produce sperm and have them, but maybe they need to have a medical procedure done to be able to obtain those sperm.
Okay, thank you. If anyone is watching and you've just got some semen analysis results, or you're looking to have semen tested and you want to ask Steph anything from Legacy, please do ask away. She's happy to answer your questions. You mentioned, that you give people their results. Do people talk to you solo, or is there a team of people who people speak to once they've got the result? What happened? Like, who in the team do people talk to as well as yourself?
So we do have a team. We have a team comprised of urologists as well as fertility nurses. All of us have specialized with Legacy in fertility, including the urologist who sees some of our clients as well. So you very well could get me on a call. You could get one of our other providers. It comes down to scheduling. We have people on all coasts of the U.S., so we can cover, many different time zones for clients' convenience.
Okay. And in terms of the kit, where does Legacy ship to within the US? Everywhere.
We should absolutely everywhere. Yeah, every state in the United States Legacy can support.
And as I mentioned to anyone joining, if you use code FHH20 at checkout, I'll pop the link in bio now. You can get 20% off the testing kits. You also have supplements, don't you, to support sperm?
Absolutely. There's been a lot of clinical research done over the years on various supplements and their impacts on sperm parameters. Legacy has a couple available on their website. One is a CoQ10 supplement. It's an antioxidant that supports sperm health. And also they have put out, I'd argue, one of the best on the market comparatively, a male fertility supplement. It's sort of a men's prenatal, so to speak. And that's going to have not only the CoQ10, but lots of other really important things to help improve fertility parameters. And something I like that Legacy chose to do that no other companies that I've seen have really taken into consideration is their packaging. Everything we warn people about in regards to endocrine disruptors, the BPA and the phthalates and the things that are in our plastics that are harmful to us and that we know can cause reproductive issues. Then you get this fertility supplement bottle in the mail and it comes in a plastic bottle. Yeah. So counterproductive. Legacies come in glass jars. They took all of these extra things into consideration, which I appreciate from a medical standpoint.
I love that. What's the prenatal called?
It's the men's, if you're looking on Legacy's website, it's the male fertility supplement blend.
Okay, that's great. And that goes out, that's for people in the US too?
Correct. Any state in the United States.
Okay, fantastic. Is there anything else that you think would be important for people to know about in terms of testing results? We've had a couple of questions just now about shocking results, bad news, how that's delivered. I know you mentioned that before, and you've obviously, even meeting you today, anyone would be very fortunate to have you as their fertility nurse. But you mentioned shock. Do you find a lot that men might be surprised at the result, thinking everything's fine, and then it's just like a bolt out of the blue, and it's like, oh, the worst news you could give to someone?
Yeah, I would say that there's always the cases where maybe someone had a surgery in the past or a traumatic injury, something happened and they're expecting there may be a problem, or they've been told, hey, you might have problems in the future. But I would say the gross majority of people are doing this testing either because their partner told them to, or they were told by another doctor, oh, everybody has to get tested. No one's really expecting that it's them, Yeah. And that's probably the hardest part, is that most people go into this thinking, it's not me, but I'll do the test and that's fine. And so in cases where people do find out, the issue is on their side, it is quite shocking. And I think making sure that you have somebody available to talk to in the moment that can help you navigate what this means. And again, like I said previously, just because things are not in the normal reference ranges does not mean that there's a problem, doesn't mean you'll have challenges conceiving. You need to know what your numbers mean for your specific situation.
And also, on the flip side, I'm sure that you get lots of people who might be panicking, thinking, I think there's going to be something wrong with my semen analysis, and then actually it shows that it's okay.
Yep. Yep. We've seen both sides of it. And absolutely, I had a conversation with somebody the other day who I said, do you realize, you thought this was not good, but you're in the top 25% of people in the world on this parameter in particular.
Amazing.
Like, this is a good result. Sometimes people just don't know what the numbers mean, especially if you dive into that Google black hole of information that, people think, no, it's not good. It's not good. And in fact, it's quite good. Arguably one of the better tests I had seen in months. And this poor person thought they had a problem.
Yeah, amazing.
Yeah.
Also, it's really not expensive considering it gives you so much to go off. And it's definitely a first step, isn't it? So, and doing it
Absolutely.
in the privacy of your own home as well. Like you'll know firsthand, like how, the clinical experience of giving a semen analysis can be less than favorable. So having the privacy of your own home to be able to do that is, and also to hear the news, can be, I'm sure, a better environment in many ways.
Oh, absolutely. Doing it, well, I come from a hospital background. I am quite well versed in the discomfort that, patients receive when they're going to produce a sample and everyone's walking outside the door talking about lunch. You're in a room dozens have been in before you. It's very uncomfortable. At home, in the privacy of your own home, on your own schedule, being able to produce your sample is so much more comfortable. And the same with receiving results, good or bad. I mean, some people are celebratory with their results and some people are feeling a little bit down about that, and to not have to walk through a waiting room full of people and navigate the parking attendant and, go through all that when you've just, either, heard something wonderful or heard something maybe not ideal. It's definitely a much better option.
Yeah, amazing, amazing. Any last thoughts in terms of, we've mentioned supplementation and Legacy have this brilliant range, which people should check out via the link in our bio. But is there anything else you think people should take away in terms of things they can be doing at home to optimize sperm quality and sperm health, even in advance of testing or after a test?
Absolutely. So knowledge is power. So testing, whether you're trying to conceive now or not, at least know where you stand, know where your baseline is. Then you can make your decisions and your plan of action from there. The other thing is be proactive. Storing your sample years ago was so cost prohibitive for people. Now it is so inexpensive. Banking a sample to have just in case, you never know. And I said, the male end is your 50% of the puzzle. You could have perfect parameters, but your female counterpart may have fertility challenges that require you to undergo some assistive reproduction with either IUI or IVF. Having a sample banked, as soon as possible. We know sperm quality declines with age, unfortunately. And so, the sooner and earlier you bank a sample, the better if you ever do need that. It sort of works as an insurance policy, so to speak, something to fall back on just in case.
Because you have people from the trans community as well as people who may be about to undergo cancer treatment, etc., don't you, who might be banking sperm for various reasons?
Absolutely. We see people who just say, hey, I hope to have children someday. I don't have a partner yet, but just want to be prepared. We definitely see a lot of people prior to medical procedures and treatments that will cause issues or impact their fertility. People who are going to be going on testosterone replacement therapy or gender affirming hormone therapy. So truly, it's a huge field of people who would seek out our services and utilize them. And, we are able to support all of those various personas in their fertility journey.
Which is brilliant. I guess a bit like egg freezing. It's becoming less taboo, isn't it? And the stigma is hopefully, little by little starting to be removed.
Absolutely. And this is so much easier. That freezing eggs is a process, and there's some uncomfortable procedures that go along with that. With this, as crude as it sounds, this is something men are already doing at home anyway. So why not store and freeze it, right? Mm-hmm. It's definitely not something that is painful or uncomfortable. You can do this in the privacy of your own home with no stigma. No one needs to know what you're doing. I think more people do need to talk about it. I think that's important because still we find that people, they're uncomfortable saying the word sperm. No one wants to talk about the male side of fertility. That needs to change.
I agree. Well, Legacy have written some absolutely brilliant, really, really good detailed articles all around all of the topics we've been speaking to today. So if you head to our link in bio, you'll be able to read more of those on their website too. And as I mentioned, they're kindly offering our readers 20% off with code FHH20. So please do take advantage of that. And as you said, knowledge is power. So it's never never too late to find out what's going on.
Absolutely. And in so many situations, even if you find that something is maybe suboptimal, there are things in many cases you can do to fix that. Sperm life cycle is 74 days. So, in a shorter period of 90 days, even, you could essentially flip those numbers into, a higher or more favorable category to increase your chances of conceiving.
Well, that's the other thing that you do, isn't it? Give people advice to optimize that so that they can repeat the test in X amount of days and look to get a more favorable result. So it's not just, here's your
Absolutely.
result now, bye. This is like, we're here to support you to make this what you want or need it to be.
Exactly. We're here to help you come up with a plan. We can't provide you with a medical diagnosis. That's not something you can do just via Zoom. Obviously, you would need more in-depth testing in many cases, but we can absolutely give you the tools you need to plan, to figure out where to go next. What do I do? In most cases, people don't know, what is your next step? Okay, now what? And that's something that Legacy can support you with.
Well, from someone who, my husband didn't have that support, I think it's absolutely wonderful, and we love what you guys are doing. So everyone should check it out. And thank you so much for your time today, Steph.
Oh, thank you very much for having me.
Okay, thanks everyone for joining. Bye.
Take care.
Bye-bye.
Bye.
Bye.